Hi there, we are Group 3, so we will be tackling Chapter 3 of Pursuing the Triple Aim, which is about CareOregon and its affiliated clinics. Our group members are Taylor Atkinson, Evan Chipley, Rachel Fenimore, Scott McMahon, and Kevin Wu. So CareOregon is a Medicaid-managed care plan in Portland, and it has been able to improve the quality of its care while keeping costs low by identifying innovative ways to partner with provider organizations and improve the health of its patients. The success of this innovation began, as most do, with a crisis. So the crisis of 2003 was when CareOregon realized that they were actually on the brink of financial collapse. Medicaid payments were not increasing at the same rate as the medical costs were, and they hadn't properly prepared for this. This was an issue because 95% of their patient population were at or below the poverty line, and Medicaid was their only chance of paying these medical bills. At this time, they realized that they were spending 60% of their dollars on just 12% of the population. These would be the patients that had multiple chronic illnesses, a lot of mental and complex things going on at once. And at the time that they kind of came to the realization of all this and decided to look for help, they only had money on hand to cover 4 days of operation, which is cutting it pretty close. So the goals of the analysis, the CareOregon's medical director, David Labby, is responsible for the first quote here that said that they wanted to get at the cost issue by changing the healthcare delivery system. And the CEO, Dave Ford, is responsible for the second quote, which says, "We don't want quality care, we have to deliver high quality care." So their approach to how they were going to change their business was by improving quality over cutting anywhere else. They were responsible enough to learn from innovators, which I think is so important. They engaged with a company in Sweden, some associates in England, the South Central Foundation of Alaska, Health Partners of Minnesota, Group Health in Seattle, and even the Institute for Healthcare Improvement, and particularly its senior fellow, Thomas Nolan. So they chose to focus on 6 elements of quality, as noted by the 2001 report, Crossing the Quality Chasm. These 6 elements were safety, effectiveness, being patient-centered, timely, efficient, and equitable. And then they also, how they began their whole analysis and study was they identified their target patient population, which again was those complex chronic ongoing conditions, and they actually asked their nursing staff to dig into each of their cases and find out if they had family support, if they were likely to change health behaviors, what their housing conditions were, if they were seeing PCPs normally, and then they used this information to make a plan for improvement.
So, CareOregon essentially covers patients who are under Medicaid, who are poor, who are unemployed, and have multiple conditions. Some have multiple chronic conditions that they're battling, while some only have one. Many of them also have mental diagnoses and require psychiatric or behavioral health consultations. However, what is going on in 2003 is the rising care medical costs wasn't being met with increasing payment rates. So there was a really extreme urgency to figure out how they could lower the costs as well as find a better way to deliver and be more effective in serving this patient population. And in the following year in '05, they were able to negotiate with the providers and tell them that they could pay $2 more per patient. And the providers were actually extremely unhappy with this. They still thought this was extremely poor compensation. And what they did was they created the care support system. So what they did was they told the physicians that if you were looking or seeing changes, make a proposal and write it up, and proposals would be weighed and analyzed and see which one was the most effective. And the money that was raised, the additional money, the funds could be reinvested to address and make those actual changes. So I think it helped buy in and influence physicians in a positive way because now they had a role in making improvements that they saw fit. Another big strategy they took on was looking at places that had a really effective healthcare, and they went to South Central Foundation. And essentially, South Central Foundation was much more team-based care, which allowed them to address um, multiple patient factors that could affect how the patients adhere to plans and if eventually ultimately affect the outcome of the health of the patient. So the primary challenge is, as before, is there is CareOregon is really trying to serve a very vulnerable patient population that requires multiple parties. A lot of them have multiple diseases. Many of them have mental health conditions, and what they were doing before was they were trying to address each thing individually, and there was no communication, no coordination, and that was completely left to the patient. And with a patient that has dealing with so many challenges outside of the clinic, outside the hospital, it was almost impossible for effective care to be delivered. So there was frustration with the physicians, thinking that the patients weren't abiding by what they were saying, but it was much more complicated than that. So what they did after learning from South Central is they started forming healthcare teams with multiple people on a team, like a physician, a nurse, a social worker, a behavioral health specialist. And the behavioral health specialist was the consensus that was a huge turning point in CareOregon's healthcare change. Being able to deliver and help with the mental aspect and the behavioral aspect of the patient allowed them to have a higher probability of success. They also had a challenge of restructuring the provider compensation, and what it became was a much more accountable care organization like format, with population care being addressed and compensation being delivered with having less procedures or less unnecessary tests being ordered. There would be rewards to reinforce that type of cost effective and cost safe behavior, as well as rewarding quality measurements for conditions like diabetes.
So yeah, now we're going to talk about some of the alternatives to the plan that Care Oregon carried out. To be honest, this was a pretty difficult section to come up with simply because Care Oregon's plan was so comprehensive. It was really more than just one plan. They had their initial goal of restructuring primary care, but they also did an excellent job of coming up with sort of auxiliary contingency plans to make sure that nothing fell by the wayside while they were implementing this sort of grand central plan. And that's why I think that the alternative, most organizations in their shoes would have essentially ended up doing only a piece of CareOregon's plan, one facet of their overall plan, rather than tackling it from all angles like CareOregon chose to do. I think most people in that scenario, and we see this a lot, would have just switched to a more value-based care repayment system for clinics and hospitals. Identify certain metrics that effectively attempt to measure quality of patient care rather than just, quantity of visits and such. And then use that as a means to reimburse, give bonuses and such. Now, CareOregon did do this after implementing their restructuring of basically the primary care product. They did identify certain metrics, actually clinic-specific metrics, to give bonuses and repayment options and whatnot. But I think most organizations probably would have gone with just this alone. I mean, we see that happening, and it can certainly have some success. But like I said before, this plan would really only be a piece of what CareOregon actually ended up doing. Another thing that I think would have been pretty effective to a degree would just incorporating the psychosocial outreach programs that they did, these motivation interviews to make sure that patients are coming back for prompt care, that patients don't fall through the cracks and are never seen again until they're critically ill. Uh, I believe that this was a very key part to the success of CareOregon, and the people behind the plan themselves said this was probably one of the most important aspects of it. So implementing just this without the other things would have surely seen some success, I believe. But again, CareOregon went above and beyond by doing many more pieces. Another piece that people are trying to kind of incorporate with the value-based care that I mentioned before is just incentivizing cooperation between clinics and hospitals. So more rigorous review of patients' charts prior to treating them, making sure that chest x-rays, blood work are not repeated when they don't need to be, sort of increasing the value of care, not spending frivolously just because, it's easy. And then another thing I thought, and this was utilized to a degree, but a big issue, of course, was, getting patients seen on time and just volume of providers. And so I honestly think a great, easy way of fixing this problem would be to expand primary care and IM residencies within the area. I mean, when you get down to it, a resident is effectively, yes, somewhat inexperienced, but they're also just a very cheap physician. Granted, they go on to become attendings, and that could increase costs down the line, but in the short term, certainly increasing resident programs is a great way to, kind of get cheap labor, for lack of a better term. And finally, our recommendation going forward is honestly just keep up what they're doing. CareOregon has done an excellent job addressing the primary care needs of their patients from many, many angles. And the evidence of their success is, kind of undeniable. Specialty use, admissions, and urgent care use were all decreased by over 30%. And actually, specialty use and admissions decreased by nearly 50%. Obviously, they poured a ton of money into this restructuring, and it took quite a bit of labor and funds to do so. But with these sort of numbers, after I think it was like 5 or 8 years, with this decrease in specialty care, I think that they're going to end up seeing that money back, basically, in terms of costs saved. There were only a few items I thought that they could work on. So in the 5 or 8 year span, whichever it was, ED utilization actually stayed the same. This sounds unimpressive, but the surrounding areas that were not under CareOregon's sort of authority all went up by 10%. So while the rest of the area was going up by 10%, CareOregon's patients basically utilized it the same amount. So that's still a feat, but I think they could probably do better. They've done a great job so far of really analyzing and diving into the data. Obviously, a lot of their mission was personalizing care, but at the same time, they're doing an excellent job with, analyzing trends on a macro scale. And I really think that if they dove into it, they could, with years of data, find out what is something we could do to address these patients who are still using the ER, because I'm sure it's still being overutilized by certain patients, and maybe identifying that could help them going forward. One of the things I thought was coolest about this CareOregon restructuring is that when physicians and nurses were seeing this happening at other clinics than their own, the people who were experiencing this restructuring were so pleased by it and so sort of rejuvenated by this, this individualized care, that it made other clinics want to do it, and want to adopt this restructuring. And so I just think, going forward, just keep exposing new people to it. It seems like the type of thing where once you hear all the details and see how happy the people who are utilizing CareOregon's plan are, everybody wanted to do the same. And I think that's really cool. And then, especially if like they begin to see some money back from this, these costs saved with specialty use and admissions, maybe begin to address some of the other socioeconomic issues for some of their patients. Like I know transportation can be an enormous issue for people without a ton of money, and same with housing. But otherwise, CareOregon has done a great job in the last 10 years, and I think they should just keep up what they're doing.
We've reviewed a lot of different things about the Care Oregon organization, and after going through the whole case, I think it's really important for us to try and pull the quality concepts because that's the whole point of this entire exercise is how does this relate to ways that an organization can maximize quality that they're providing. And I think one common theme we see through a lot of organizations, and especially with Care Oregon, is that much of their success and their quality comes from a strong vision and mission statement. Now, I won't read them for you, but you can read them. They're right here in front of you. And a lot of it really centers with them around them being an integrator, as it talks about, that they're willing to work with other organizations in order to maximize quality, which is really a concept that we're seeing emphasized more and more in healthcare communities, especially those that are trying to provide care to more difficult patient populations with major access issues. And one of the big ways Care Oregon does this is through partnerships with other organizations, whether they be social services organization or other community partners, in order to maximize access in the different ways that they need to provide it. I also thought a very important thing that they emphasize as far as providing quality is that they focus more on good patient outcomes. Instead of just looking at treatments, they really want to make sure that the outcomes for their patients are strong. And I think this is a subtle yet extremely important thing for us to note when we're viewing healthcare management. As actual future healthcare providers, we tend to focus more on what's happening inside of the clinic, inside of the actual office. But it's important to understand that the best thing that you might be able to provide is a good outcome at the end of the day, that you really want their life to improve. Like I said, they focus on the whole problem of healthcare access from top to bottom through these partnerships. And one of the biggest things that they do is they display that they're willing to come up with novel ideas, to really experiment with things. And my experience with a lot of organizations is that they're not willing to do this. That they just say this is the way it's always been done, so we're going to continue doing that. And Care Oregon has really showed that that's not the way they do things. They want to tackle the issues that they're trying to overcome, no matter what it takes, and they're willing to experiment with new ways to do that. I also wanted to share a few web resources. I thought it was important to be able to give you guys access to that. Just their home website here, as you can see. And then also I wanted to share their YouTube channel. I thought it was pretty interesting. They have a summary video about their organization and what they do. And they also have some other interesting videos about projects that they're in and other things about the access they provide. I thought that was really important because it really maximizes the visibility of their organization, which I think is very important. And I also shared a link to their LinkedIn page for a little bit more of a professionally oriented, social media oriented view of their organization.
So where is CareOregon today? The chapter in Pursuing the Triple Aim left off in 2011, with CareOregon clearly on the rise after its renaissance in 2003. But since then, the company has actually had so much growth that I had difficulty narrowing it down for the discussion of this presentation. So I just picked a few that I thought were interesting for this discussion. First, they created something called Coordinated Care Organizations, which is basically community-based health plans that roll all of the services such as physical, mental, and dental into one. And they manage health plan services of 4 CCOs in Oregon. Additionally, they created something called CareOregon Dental. So if you look on the right side of the screen, you'll see a little infographic of 2017 and how successful they were with this oral health integration. But they provide dental care services for members in a very specific Tri-County area. Additionally, they created something called House Call Providers, which are in-home medical services for homebound patients. They've proven time and time again that these services actually improve health outcomes, increase patient comfort, and reduce healthcare costs, which I found really interesting. And then lastly, again, you'll see on the right side of the screen the Tribal Care Coordination kind of infographic. This is specific case management services for American Indians and Alaska Natives on a fee-for-service health plan through the Tribal Care Coordination Program. So this basically includes members of Oregon's 9 federally recognized tribes. So I thought that was kind of cool. In the future, there's a lot going on, but I just picked one that I thought was kind of interesting. So there's something called the Ride to Care program, which is basically a key element of federal Medicaid benefits, but they recognized that it wasn't really meeting the needs of their patients. And so they're rolling out a new model for the Ride to Care program in April 2020. So this basically does one of three things depending on what situation the patient is in. So first, it can provide mileage reimbursement for the individuals that have access to a car but are unable to afford gas. So if a friend or a family member drives them, that they can have that reimbursement on gas for them. Second, they will provide transit passes for those taking public transportation. And then lastly, they will provide a hired driver for those that are unable to use public transportation. So if there's a physical or mental disability there. So as you can see, CareOregon has come a long way since 2003 when it was clearly at kind of a low point. It utilized a lot of the key quality concepts we've talked about in this presentation in order to kind of provide this large care to a large underserved population of Oregon. And it has been wildly successful since then. So thank you for taking the time to watch our presentation, and feel free to reach out to any of us with questions.